At this time, we are going to look at regulation of motor behavior. We are starting the discussion on the regulation of motor behavior. Having understood upper and lower motor neurons, now we can transition into the study of basal ganglia first, and then also the study of cerebellum as regulatory systems. So the basal ganglia topic has 2 hours. The first hour, this hour, is the identification of components. The second hour will be mainly the discussion of interplay between these components and also the function and some levels of dysfunction will be discussed. But right now we are introducing components so that we are not getting lost, but we properly identify everything in basal ganglia. And there is a rich history and a very rich kind of terminology behind all of this. So we need to tackle that. We need to tackle that, and of course that tiny bit of connectivity you should already know. The cortex, basal ganglia, back to cortex type of loop, feeding back to upper motor neurons, is the bird's eye view. And then of course we'll be looking at components of dorsostriatum and dorsopallidum, or just plain pallidum. So dorsostriatum and pallidum and telencephalon. And then there will be a ventral striatum and ventral pallidum. Ventral pallidum, also known as substantia nominata in telencephalon. And we will be looking at and identifying and testing the knowledge of basal ganglia associated components in diencephalon and mesencephalon. So in diencephalon, some components of thalamus and the subthalamic nuclei will be called into play. And in mesencephalon, substantia nigra and ventral tegmental area will be identified. So having said that, basal ganglia, striatum and pallidum. The nucleus accumbens and ventral pallidum are also parts of basal ganglia, but these are the so-called ventral basal ganglia. So the caudate and putamen are the dorsostriatum. The globus pallidus is the pallidum. And then associated components, subthalamic nucleus and substantia nigra. And then again, accumbens and ventral pallidum are ventral basal ganglia. However, functionally and anatomically, we make a distinction between striatum and pallidum. And the big however here, for historical and naming purposes, the putamen and globus pallidus are nearby, and in some sections, in cross sections and horizontal sections, they look like they stuck together. And that is historically called lenticular nucleus. We'll point to this. But understand that one part of that is striatum and the other part is pallidum. We'll make sure to point that out. But generally speaking, which is really useful for the functional understanding, I would like you to think of basal ganglia as striatum and pallidum plus associated components. Fair? I think it's very fair. All right. So with that, the largest source of afference to basal ganglia is from the cortex. And this becomes part of a looping neurocircuitry. And you see multiple channels feeding back, multiple functional channels feeding back to cerebral cortex, regulating the activity of premotor and motor areas of the cortex. What do basal ganglia do? they reinforce the selection of motor programs, or conversely, they suppress unwanted motor programs. And you might be surprised that both of these aims need to be accomplished at the same time. All right? So therefore, disorders, and we'll delve into this in the second hour a lot more, disorders will be categorized in two opposing bags. The hyperkinetic disorders, unwanted movement, and the hypokinetic movement, paucity of movement and poverty of movement. So either the impoverished motor programs, hypokinetic, less than desired, and unintended motor programs breaking through, that's too much, it's hyperkinetic disorder category. So having said that, let's identify components. So we're taking a general kind of a mid-level, mid-caudal level cross-section, coronal section of the forebrain to get us started. This will give us the greatest bang for our buck, so to speak. And that is why the textbook that has this is from Purvis neuroscience textbook that we don't normally use, but I imported several illustrations from it. This is the reason why they chose this level, because you can look at diencephalic and telencephalic components. So bilocalization, telencephalic components, striatum. So that includes subcortical telencephalic gray, the caudate nucleus. So this happens to be the body of the caudate at this particular level, and the putamen. So these brown areas, so areas labeled in brown, are part of striatum. And also what is not visible here will be the nucleus accumbens and ventral striatum. All right? But it's still striatum. It's going to be a lot more anterior and a lot more ventral when we get there. But understand, under striatum, we have caudate and putamen. Under the pallidal component, we have globus pallidus here, and in a like color here. So that's that medial tip, a tipped over ice cream cone, if you will. That's going to be your globus pallidus here. It's called pallidus because of the pallor in an unstained section. It has more myelin, and the inverse is true. In a myelin stained section, this will look a little darker. Okay? Okay? Very good. And then the ventral equivalent of that is the ventral pallidum or substantia nominata. Again, we cannot see this, the ventral components, in a mid-level or caudal cross-section. And this level was chosen, that is at least mammillary level or behind, so that you can look at diencephalic components. How about that? Associated circuitry. So we have striatum and pallidum, and then we have associated neurocircuitry. Some thalamic nuclei are recruited, because ultimately, you know that we're bringing the signal back to cerebral cortex. So thalamus, those motor nuclei of thalamus are recruited. So we have that. And the subthalamic nucleus in caudal diencephalon, that's the green area that we also looked at in diencephalon, is recruited for certain functions. The so-called indirect loop of basal ganglia circuitry will go through subthalamic nucleus. So we'll have a keen eye to recognize that. And then we can jump down to midbrain for another important set of associated regions, and that will be substantia nigra substantia nigra, pars compacta, and pars reticulata. So both the pigmented and non-pigmented neurons of substantia nigra, and also the more medial VTA, ventral tegmental area, are important as associated nuclei in neurocircuitry. So for the striatum, which we already recognized as an information receiving area of basal ganglia, right? So let's talk about striatum, how to localize striatum. So again, we need to look for three components. The caudate, the putamen, and nucleus accumbens make up the striatum. And embryologically, they come from the same primordium. And then throughout development, some of these components grow and they follow the shape of the ventricular system. Now that describes the caudate nucleus. And it becomes one of our C-shaped structures in forebrain. So the caudate is one of our C-shaped structures. Another one is corpus callosum. So likewise, if you remember that, how it goes. And another one is the fornix. The fornix connects hippocampus to mammillary nuclei, for example. And all three, these letter C shape structures, can be somewhat parallel. So the caudate nucleus is one of them that does this. It even has a tail that goes down actually close to hippocampus on the side of the inferior horn of the lateral ventricle. So it kind of spans. But striatum starts out here embryologically by actually the merging of caudate, putamen, and nucleus accumbens, and the nucleus accumbens stays in place where I'm hovering. So it's very anterior and it's ventral. So you see how medial and ventral and anterior this is. So anterior is pointing this way, anterior pointing that way over here. Anterior, of course, is over here. Anterior is still on my left here, right? So nucleus accumbens is that anterior and very deep lying area. And then you have the putamen adjacent to it. And the caudate coming from the caudate head, which is more anterior and bulky. And then eventually transitions to the tail that follows the shape of the lateral ventricle. So see what it does. Becomes that big letter C. Okay? And then the tail ends up next to the inferior horn of the lateral ventricle. So it's very important to think about this and imagine this kind of transition, that we encounter the caudate at so many different levels, and we always encounter our nucleus accumbens at very anterior or septal levels. Only at septal levels, where you see septum pellucidum, very anteriorly. So it's useful to hover over a semi-transparent reconstructed view so we can imagine these internal structures. And of course the caudate and the putamen are separated by bands of white matter, which we recognize as the internal capsule. Okay? Awesome. And all of this is because the embryology and the development of the lobes that will pull, if you will, the caudate along the ventricular system. Is that fair? I think it is. All right. So by reviewing it, caudate nucleus has a letter C shape. And depending on where you cut, you'll have a differing kind of view, right? So the head is adjacent to the frontal horn or anterior horn. Yes, indeed. And this is from a Michigan collection of sections, the head of caudate. and the slender and long body. So if you're cutting here from a tuberole hypothalamus, this is from Nolte, then we see the body next to the body of our lateral ventricle, LV. Very, very logical, right? So it's a big C-shaped structure going around. And eventually, if we had one, and especially one here that's more caudal, we would see a little bit of tip here, bottom tip here. That would be the tail, but then I'm expecting to see hippocampus instead of amygdala here if I'm poking at this level. We don't have that. We don't have that, but could we take a third section? Yes, absolutely. All right, so don't be surprised to see a tail when you're down here in the temporal horn of the lateral ventricle. All right, the tail, that bottom curvature, right? Whereas the nucleus accumbens, now it's a big jump anteriorly and ventrally. So at a level, so we just jumped back here, anterior at a level where we have a nice septum pellucidum, and then we have the confluence of caudate, putamen, and accumbens. So kind of recapitulating that embryologic origin of all of this striatum, right? And all of these are brothers in that sense. They're living nearby, but only here, only here. And of course, third component, that lateral component, is my putamen. And my putamen is over here. My putamen is over here, P, letter P. The putamen is separated from caudate by the developing connections to and from cerebral cortex, the internal capsule. You see that? The anterior limb here, and now much more posteriorly, the posterior limb of internal capsule. We're skipping the genu. The genu, by the way, and I'm saying this for your reference, the genu of internal capsule would coincide with the interventricular foramen area. Okay? That's a lot more obvious to follow in an axial or horizontal view that I showed you previously, rather than a coronal view. All right? But I trust that you can handle this information. All right? So right now, in terms of the intricacies of our internal capsule, this is anterior limb, and this is posterior limb. And we have septum here, and when we have a septal level, and we're in front of our lamina terminalis, we're in front of our hypothalamus, then we look for our nucleus accumbens. Okay? But understand that nucleus accumbens, caudate, and putamen together, various forms of striatum. And now for the pallidum. The globus pallidus is immediately lateral to internal capsule and medial to putamen. All right, so medial to putamen, immediately lateral to internal capsule. So the internal capsule here, that blob of red here is labeling globus pallidus. So this is relatively rich in myelinated fibers, as I said before, hence the term pale in an unstained situation, right? And it's further subdivided into an internal and an external division or segment. While the striatum is the main input receiving area of basal ganglia, we recognize pallidum as the output area. And then we'll be tracing these outputs to various places. It can be thalamus, it can be subthalamic nucleus, and in a roundabout way may go to thalamus. Okay, very good. So then the ansa lenticularis and lenticular fasciculus and the thalamic fasciculus connect connect globus pallidus to thalamus. So there are white matter tracts making all of these connections that you sometimes see. So once again, just to recap everything, look at the reconstruction for dorsal-basal ganglia, and look at our axial section, horizontal section. Look at our coronal section, we're reusing it. Okay, caudate nucleus, putamen, globus pallidus make up the dorsal basal ganglia. So in a reconstruction, you follow that. In a horizontal section, we see the head of the caudate adjacent to the anterior or frontal horn of our lateral ventricle, right? I always look at the shape of my ventricular system. I always look for my internal capsule. So it's right in front of it. That's the head of the caudate that degenerates in Huntington's disease. So there will be a very critical sign in some of our medical images when you see that. And then you're going to have the putamen here, and then medial to it, but lateral to the genu and the posterior limb of our internal capsule is going to be our globus pallidus. So once again, caudate and putamen together is striatum. We cannot see our accumbens. We'll look at it separately. And the caudate and putamen forms the neostriatum and dorsostriatum. The globus pallidus is the pallidum. And then for historical and naming purposes, the putamen globus pallidus formed, quote, the lentiform or lenticular nucleus, not an actual nucleus. Okay, I mentioned this before. So the putamen part is striatum, the pallidal part is globus pallidus, right? But they seem that they're together, so it shows up like a slice of an orange. We can use that illustration in a horizontal section, right? Shaped as a lens, and hence the term lenticular, right? And we already used that. You might recall the retrolenticular limb of internal capsule. You may have wondered, where was that coming from? You know, what is this lenticular business? So some of these old anatomical names are referencing places relative to the lentiform nucleus, which is putamen and globus pallidus together. And then some of the white matter may go behind it, and some of the white matter may go under it. All right? So let's not worry about it too much, but get the idea of lenticular nucleus. And here's the ice cream cone representing, once again, putamen and globus pallidus together when you're in a coronal section. So in a horizontal section, looks like lens shape or slice of an orange. In a coronal section, it looks like a tipped over ice cream cone with the ice cream on top, and the base of the cone that you hold in your hand, that is pointing medially and inferiorly. So I'm holding the ice cream cone by the globus pallidus, if you will. And then the flavors that I have up here would be putamen. All right? Very good. Now, so we covered dorsal basal ganglia because they're functionally distinct. So dorsal basal ganglia, your caudate, putamen, globus pallidus. Ventral basal ganglia, ventral striatum, ventral pallidum. And for ventral striatum, we are going to make that synonymous with nucleus accumbens. So ventral striatum or nucleus accumbens. We'll make that synonymous, and the ventral pallidum is either called the ventral pallidum or it may be called substantia innominata. And the substantia innominata has some other components. It has the nucleus basalis of Meinert, with the acetylcholine neurons, but it's nearby. It's nearby, that area. So how is it organized? So again, it will not surprise you that we will be choosing more anterior levels of the forebrain. We will be looking at these levels of the forebrain. So it will be either in front of lamina terminalis or just hitting lamina terminalis and behind where the preoptic area is. Okay, so we must go either in front of the third ventricle or just touching the rostral tip of the third ventricle. So again, I'm focusing on the ventricular system of the brain to understand the level that is in front of me, right? So once again, the nucleus accumbens here is considered the medial extension of the caudate and putamen, right? So that place that in embryologic development, actually it was never displaced. It stayed, so to speak, in this very anterior and very ventral localization. So therefore, we're not at all surprised that we see this bottom corner here. As you go down the septum is going to form further down the diagonal band of Broca and that sort of thing, and you're touching the bottom of the brain, and gyrus rectus will be here, and the optic nerves are here. Gross anatomically, when we looked at the brain, so you're in that area, and you're just deep to it. It's next to septum, deep to septum, nucleus accumbens, right? And this is the area where all original components of the striatum flow together, because there's only partial separation by the anterior limb of internal capsule. And I think that's beautiful here, right? So all of this is striatum, except we call this ventral striatum. And there's a good reason for that, because a lot of the psychomotor responses, a lot of the initiative taking and emotional motor responses, so-called, are regulated from the ventral basal ganglia rather than dorsal basal ganglia. So it has critical roles in neurobiology and psychopathology and everything else. So this was our ventral striatum. There you go. I mean, unmistaken, right? You can't get lost if you follow these guidelines. And it's a very taggable structure, so to speak. So in this situation, of course, I copied the Michigan section without the labels, right? And you can turn the labels on and off. And here's another one. So it's further caudal, a touch. So I am seeing the columns of the fornix. I am seeing a nice anterior commissure forming here. And the important thing is there is a third ventricle. So that will take me to preoptic area, just adjacent to my third ventricle. And the ventral pallidum is going to be just lateral to it. So you see ventral pallidum, just ventral to globus pallidus. So now we have caudate, putamen, globus pallidus, well, pallidus, but it looks darker and myelin stained, right? And then ventral to it, at this particular level, is your ventral pallidum, also known as substantia nominata, right? So over here, the ventral extension of globus pallidus. No surprises there. And this is an area that will be just deep to the anterior perforated substance. So we related to some of our studies that we had in the laboratory, and we looked at the brain from the ventral point of view, and we pulled the vessels out, and we saw those little dots, those very proximal branches, arterial supply that will go into these areas known as the anterior perforated substance. So that part of the brain is ventral pallidum. And ventral striatum and ventral pallidum form an anatomical and functional complex for these, all of these psychomotor related responses. So once again, substantia innominata or ventral pallidum, where the asterisks are, it is absolutely critical that we recognize this. Just lateral to preoptic area. Very good. So let's review these components. So starting from a very anterior view, we see our septum pellucidum. Let's find basal ganglia components. What kind of components can we find? Well, coming down the septum, and we have, first of all, what is number 2, the anterior horn of lateral ventricle. What is number 12, the head of the caudate. And then we're going to have putamen over here. Then we're going to have our good friend nucleus accumbens, because you're riding down the septum and you're arriving at this region. That's not the base of the brain yet, but this area where all components of striatum flow together. And because Nolte used the slanted section, we do get a little bit of globus pallidus. That should not bother you. To me, it's kind of a weirdness here, but the focus is on these components of striatum, one of which is ventral striatum, and these are dorsal striatum. Of course, we're going to have the anterior limb of internal capsule, and you're pointing to this white matter. The anterior limb of internal capsule, which partially separates, and then that tiny bit of globus pallidus that may exist. The real mid-level section will yield a much bigger view of the dorsal components in this sense. So mid-level forebrain, so that's typically tuberal hypothalamus, and the posterior limb of the internal capsule is visible here. So we look for the body of caudate, putamen, and globus pallidus. You remember our ice cone, ice cream cone. The ice cream cone is here, and we remember the body of the caudate up here. The body of the caudate living up here. So it gets stretched next to the body of the lateral ventricle, and then we're going to have our putamen. So that's number 3 on this illustration, and then we have the bottom of the ice cream cone as globus pallidus, and we see some of the white matter tracts, actually some of the white matter tracts going from globus pallidus to places like thalamus, right? So you see some of those as well. And then when we look at our more caudal levels, we're going to have our subthalamus, the subthalamic nucleus, down here, and then the ansa lenticularis, the lenticular fasciculus, connect globus pallidus to thalamus, and then the thalamic fasciculus, and that's going to be up here, connects a globus pallidus to thalamus. So it will be pointing to the VL nuclei. The subthalamic fasciculus connects subthalamic nucleus to globus pallidus. So there will be a pretty intricate connectivity of bundles of axons here. So we have a recap over here of our general organization of basal ganglia, and then the bundles of axons from globus pallidus, let's go back, the ansa lenticularis and the lenticular fasciculus loop around, and that will be going to thalamus, and they contribute to the thalamic fasciculus. So the destination, as this arrow is showing, is going to be the thalamus, and they carry the output of globus pallidus to the thalamus. So that will be the overall output of globus pallidus to thalamus, and that is coming from the internal division of globus pallidus to thalamus. So the second hour will hit all of these details. We're going to have to hit the so-called direct loop and the indirect loop through basal ganglia, and they are serving opposing functions. One is promoting movement, and the other one is restraining movement. How about that? But we'll hit this in the second hour. So still finishing up the first hour, we'll just look at substantia nigra and midbrain. Really nothing fancy about it, in the sense that you have already encountered this, the pigmented neurons in pars compacta, in typically mid-level. Midbrain is a good sample for this. Pigmented neurons in pars compacta, and the non-pigmented neurons just ventral to it, adjacent to the cerebropedon cause. Pars compacta is dopaminergic. The pars reticulata, which is non-pigmented, is GABAergic, and is thought to be an extension of pallidum. That very curious situation, that functionally they're GABAergic neurons, and they do something completely different from the dopaminergic neurons here. But that's your substantia nigra, SN. And very importantly, the dopaminergic projections from the pigmented neurons form the mesostriatal, also known as nigrostriatal projections. So this is your pars compacta, pigmented neurons, and this is your pars reticulata, the non-pigmented neurons. And I'm thinking of GABA here, and I'm thinking of dopamine here, and nigrostriatal from here. Awesome. So generally speaking, dopamine projection systems have been looked at this way. So we've taken care of this on the previous slide. So that's your nigrostriatal projection. We still have two that are both originating from VTA, ventral tegmental area. And this is from Blumenfeld, also used by Dr. Leonard in his introductory lecture on neurotransmitters. So this is from VTA, ventral tegmental area, the mesolimbic and mesocortical projections. Mesolimbic projections will go to primarily nucleus accumbens and some very medial regions of cerebral cortex, but mainly we're thinking of nucleus accumbens, the mesolimbic projections. And they're all dopaminergic, but they are from non-pigmented neurons, from VTA. The mesocortical will go to prefrontal cortex. So very much in line with the hypothesis that these are related to the ventral basal ganglia function and more of the psychomotor and taking initiative and that type of behavioral functions. So VTA looks like this. So it's kind of, you might consider it sort of a nondescript little area. It will not stand out, so over here, as much as the substantia nigra stands out, but it's over here, and there is dopamine in these neurons giving rise to the mesolimbic and mesocortical projections. Now, nevertheless, very, very important projections. Psychomotor behavior, a lot of drugs that release dopamine hijack these pathways. So this is just a review. You might consider it a self-test of basal ganglia or basal nuclei. At one point, because we know that ganglia are supposed to be in the peripheral nervous system, at one point there was an attempt to modernize and rename these. That, like many things, never stuck, and the old name is still there, and we call them basal ganglia. But don't be surprised if basal nuclei are mentioned, same thing. And related components, self-test perhaps, and one that you can do on your own. So this is a slab of the brain which is stained by cell stain, so white matter is white, and then gray matter picks up this grayish blue stain, and then you can identify all of the following. So the lateral ventricle, where it is. The caudate, can we look at a head? Yes, absolutely. Putamen, globus pallidus. Can we even make a distinction between the internal and external divisions, globus pallidus? Perhaps. And for sure, internal capsule. We can look at our putamen, globus pallidus. External capsule is just outside putamen. Claustrum, also related to basal ganglia functions. It's really unknown what claustrum does. Claustrum is a very thin sheet of gray, and then the extreme capsule is lateral most, just underneath the insular cortex. That's a piece of white matter. So we can look at those, can take that away, look at this, perhaps clearer. I mean, look at that. Putamen comes into view, the extreme capsule, that very narrow claustrum, and the extreme capsule, if you wanted to focus on that. Keep in mind, thalamus is always medial to the posterior limb, always medial, posterior limb of my internal capsule and adjacent to third ventricle. A story regarding coronal sections, very, very anterior level, septal level. I'm looking for accumbens, other parts of striatum for the most part, identifying septum. Mid-level, then I'm supposed to see the body of caudate, because previously we looked at the head of caudate that bulges into the anterior limb, right, and our lateral ventricle. And at a mid-level section, we can see the body of the caudate. We see a very substantial thalamus at that point, and a posterior limb of internal capsule, and then our typical ice cream cone with the globus pallidus and putamen. Done deal. So at the mammillary level or behind, I'm supposed to find my subthalamic nucleus as a region of interest. When I'm in midbrain, I'm supposed to look at my substantia nigra, the two components, compacta and reticulata, and also my VTA. So VTA is down here. What do they do? Well, I need to think about that. This is my substantia nigra, dopamine, and GABA, VTA, only dopamine. And there are many, many clinical and functional aspects of this. Movement disorders is the clinical, the really big bag of things that can occur. So either a hyperkinetic or hypokinetic category of movement disorders. So typically by either striatal damage or something happens to dopaminergic input, and there are also behavioral signs. So either an overactive or underactive manifestation, and mainly from the ventral components of basal ganglia. The dysfunctions would be blamed on some of the behavioral manifestations. So with that, this was the first hour in basal ganglia, the introduction component parts, and whatever they do and how they are connected and the intricacies will be explored in the second hour. So, thank you. I'll see you next time.